taking a video of your teeth, but it becomes a 3D picture, a 3D image. So for example, in this, so we this is how we do it. So, for example, this is a patient, no? So we'll just
Wow. That's amazing.
it's in the lab already, and they don't have to do anything. So when it arrives in the lab, they just open the case and then design right away. So they can design in like 30 minutes, and then we mill it. We don't. It's no longer doing it by hand. We have a milling machine that mills the tooth. So actually, we can deliver a crown in a day's time, even half day, depending if the lab is busy or not. So this is the new technology that we have. This is at par with the technology we have in the US, Europe. Same technology. And we have it here. So also this one combined with our CT scan, we can do what we call implant planning. Doing implants, placing dental implants. I'll show you called a CBCT. This is basically the CT scan, dental CT scan. So instead of the usual X-ray 2D picture, we have a 3D image when we take this one. And we use this to diagnose, like if you have lesions, the mouth, if you have fractures, we can use this. So a surgeon uses this to like locate fractures. And what we can also do, like if we take a CT scan, we can actually print that scan into a bone. Like for example, we take a scan of the jaw. No? We can send it to our lab and we can convert that into an actual jaw. So that's how we work here. This one. So you can see we can manipulate it. And here, right then and there, we can know if the patient is a candidate for an implant or not, because we know where the vital structures are. This is the nerve. This is one thing that we avoid when we do implants. So this makes it much safer for the patients because we know where the vital structures are located. And you will also know if the patient is a candidate for implant, because we'll know how thick the bone is, how the length of the bone, because you know implant is not just placing metal on the mouth, no? I mean metal on the bone. There are parameters that we have to follow if the implant is going to be successful. So we have to know it has to have this much thick bone on each side of the plate. So those are the things that we have to consider now. So we have been trained to do this. You know? So we have the software to do the planning. Here we have the 3D image. Then combined with the image from the intraoral scanner, we merge that, and then we do our planning. We do our complete planning, and then right after we do our planning, we fabricate what we call a surgical guide using our 3D printer in the lab. So everything is connected. No? So we planned this before, because you know the thing that frustrated me before was that we have these cases and we send to the lab in Manila, and sometimes it would take 2 weeks before it comes back. Right now we can do it 2-3 days, we're done. And if we're not busy, even a day after, it's done, because we have control of the lab. our patients would complain na walang privacy, you know, because it's a small space. We don't have control of the space anymore. And aside from that, it's very expensive. Now, so this time, we made a treatment room that is private. So we can close it. The patient wants to talk to the dentist. So it's complete here. So each room has its own intraoral camera. So we can record, do documentation of the patient's condition. And when we do the X-ray in the X-ray room, the result goes directly to the room. So they don't have to wait. No? So we all have the same equipment, and even our floor has been thought of. No, it's not just we just wanted vinyl. This one is actually antibacterial. At the same time, it protects any material like from the ceramic that we install in the mouth, because when that falls on the tile, it actually cracks without us knowing. So we want to make sure pag nahulog yan, it's still safe. It's still safe. So there's a reason for it. And of course we have this is our handheld X-ray. So what does this do? Like, I don't know if any of you have experience having root canals before.
No.
So root canals, every step you have an X-ray, no? Now, sometimes if the X-ray is not located in the same room, you have to go up with those things in your mouth. Diba? So with this one, you just stay there in your chair, and then we'll do just the X-ray. Just sit down. It's convenient. Very convenient. And this one also has a low radiation. So much that even the operator doesn't have to wear any protective. Only the patient, because all the radiation is going that way.
True.
So these are our rooms, and this is our sterilization room. So one of the things that I'm very strict with is sterilization, because I believe that our standard of sterilization is that if you're going to treat a family member, you don't have to do anything extra. It should be the same. It should be up to par. Your patient should be very safe. That's why we have steps when we do the sterilization. First is we do the cleaning in the ultrasonic scale cleaning machine. Then we rinse it. Then we have cold sterilization. Then we have this hospital grade autoclave. So this one is up to par with the sterilization in the operating room. So up to par ni siya. Even napa ni siya receipt. It has a receipt so that you know if your sterilization is good or not.